So we proceed with our next speaker, Dr. Thomas Tommy. He is a neurosurgeon from Indonesia and will be talking about fusion images in neurosurgery. Dr. Thomas?
Good evening. My name is Thomas. Is it a good reception of the sound?
Yeah, sound is fine. You need to share your screen, please.
Okay. So, um, so this is only a simple presentation regarding fusion images. So, um, advanced topics has been mentioned by Professor Ibe regarding the OR system and robotic neurosurgery, and also Dr. Divya for the CFD. I just want to mention regarding the role of the fusion image in neurosurgery. So it's simple topics and probably not taking so much time. As a disclaimer, there is no conflict of interest regarding this presentation. And so what we know that technology in neurosurgery is collaborations between engineering science, medical science, and information technology. Like engineering, they research and develop all the instruments and all the computer works for diagnostic and also for therapeutic therapy. And medical science is also, we know that the science is still growing. So with those collaborations will make a good difference, like for for advancement of the our medical health. So for history, X-rays was founded by Wilhelm Röntgen about 1895, but CT scan was developed by Hounsfield, and then MRI by Lauterbur around 1973. So there are no development between those times until the present that change our approach to the treatment of illness, especially in neurosurgery. So this is to make it simple, like the progress of technology, we can see for an example, television or monitor. In the old days, they used bulb television, and the first time is black and white only. Then they developed colored ones. Bulb television then changed to flat panel television or monitor. As we know, there were LCDs, plasma TV, and nowadays LEDs. And also the definition is getting crispier and more, higher definition, like 4K or ultra high density, or ultra high definition, But this, if we compare with the radiology, at first they use films. Then after that, they develop filmless radiology using digital imaging. Then they develop PAC system for, system that you can enter or you can take the data of any radiology in your hospital. And also their monitor of radiology is getting also better by the advancement of technology. So if we combine this modality, then we can answer the problems or questions that anatomical images are not the same with surgical or microsurgical view. That is the problem. So radiology will give us anatomical image. So they will send AP view or lateral view. That those images are not in microsurgical view. So as a neurosurgeon, we have to develop our own approach into for the image. So we process ourselves that those image will conform with our microsurgical approach. So as this is interesting journal, the topic is about image guided neurosurgery. And image guided neurosurgery is a neurosurgery that is literally guided by the image. So integration of imaging with surgery in the planning, execution, and post-operative assessment. And pre-operative planning fusion is we can combine CT and ultrasound. We can combine CT and MRI, SPECT and CT, PET or PET or with CT. Then with a workstation, we can do a co-registration, and that is named by fusion images. And acquisition usually for this presentation, for an example, is being taken in Japan. So they have Philips MRI and CT angiography using 64 slices CT. And also the DICOM is fused in a workstation. The problem in this setting is not just the device. So I know that many hospitals already have MRI, CT, but the workstation has a special software for fusion image, and that software will cost. That software is expensive. So this is the co-registration process. So MRI and CT, they fuse it in the workstation, and like if you can see the bottom right corner picture, they diffuse DWI image with CT and CT angio, and this picture they develop for to make an approach by developing 3D image to identify important structures to avoid and the target of operation. But this is still this picture is are still in anatomical view. So in Japan, I take some example. So this is a case number one, a trigeminal neuralgia case. So if you see the left side, it's dolichoectatic vertebral arteries and basilar arteries. But the problem is on the right side. If you see that there's a pica elongated and contacted the fifth nerve. So we can, by using fusion image, we can rotate the image in the workstation and see 3D. So we can maneuver the picture and see which one or which part is the problem. And if we make the orientation into surgical view, we can see like this picture on the left. is the fusion image. Red is the vessels, and the yellow is the nerves. We can identify that the offending vessels as pictured. And on the right side, during surgical view, we can see that it confirms the vessel that offended the nerve is the same with the pre-surgical simulation. And this is for hemifacial spasm. So they join also three modalities: MR angio. This one is MR venous, and CT angio and DWI. This is the orientation of the surgical view, and the same problem here is the offending vessel can be identified, and microvascular decompression was done. And this is for also trigeminal neuralgia again, and we can see that the vertebral arteries pushing the fifth nerve on the left side. This is the surgical view, and we can see that it confirmed with the surgical, during surgery, the same picture with pre-surgical simulation. So to keep it short, as a conclusion, for me, modern imaging technique like fusion image helps surgeons to have pre-surgical view, not only for vascular, but also for tumor surgery or any surgery that needs navigation for to approach the lesion. And preoperative simulation is useful, like the one Professor Sano said that before you do surgery, you finish the surgery in your imagination. I think that is the end of my presentation. Thank you. Dr. Hira?
Okay.
Yeah. Thank you. Thank you so much. So any questions on fusion imaging? Any comments by the panelists? Dr. Ichtai, would you like to add something to this?
Yeah. But the fusion image in our country may be difficult to perform because it's from their economic system or some problem. But in Japan, I know it's not expensive. But if we have the machine, maybe we can proceed like this imaging is helped us too much to perform surgery. Thank you.
Okay, thank you. And do we have Dr. Abdul Rahman with us still? What are the, how is it in Tayumin? Ibrahim, can you highlight on that?
What? Repeat, please.
The role of the use of fusion imaging in Tayumin in your setup.
MRI is Tesla, 3 Tesla, maybe. No,
okay.
3 Tesla CT and O arm and C arm.
Okay. All right.